Hello, St. Columba students. It's Mr. Carroll here. Today, we're going to be talking about vulnerable populations in the public health and pandemic video series that I'm doing. We're going to talk about who these vulnerable populations are and why they might be vulnerable, and ways in which we can help them. Before we get into who these populations are, I would like to state that public health looks at the health of everyone in a society. And that's very different from individual health. An individual should always go and talk to their doctor and their nurses and their pediatricians to find out the best healthcare process for them. But this is ways that we can kind of bring everyone's health up so that they don't necessarily have to go to the doctor or that they don't have to see it as much. So let's get started. So who are these types of populations? Well, first thing is I want to make sure you know this is a spectrum. It's not like black and white, that someone who's old might be vulnerable and someone who's young is not, or someone who needs rent money is vulnerable, but someone who doesn't need rent money is not. It can be all types of things, and it can be multiple things on each other. All right, and that's why I like using the color wheel to kind of explain this, because it's all over the place and it's really, really nuanced, more nuanced than we can get fully into in a 5-minute video. But they basically fall into two kind of categories: the sick and the needy. So the sick include people who might be old, who are immunocompromised, or who are very young. So the old and the very young have immune systems that are weaker. They're not as strong as healthy children and adults would have. And so they're not as able to fight off the virus. Again, that doesn't mean everyone falls into this category. If you eat healthy and exercise and don't have a lot of stress in your life, you can have a very healthy immune system. But kind of on the whole, these are the populations. Immunocompromised means anyone who might have other health issues underlying them. You know, someone who might have cancer, their immune system is not as strong because of some of the treatments. And so that's what it means to be immunocompromised. Now, normally, during flu season or cold season, our herd immunity helps them out. But it's different now because of the novel coronavirus. And that's why the physical distancing is taking the place of herd immunity, so that we can kind of be apart from each other, so it's harder for the virus to jump from person to person. Now, what about the needy? People who might not have enough food, who might not have enough money for rent, who may not have even clean water or health insurance. They might be needy because they've lost a job, because their business is closed down, or their company had to put people, people to stay home. They may have been having these issues before the virus hit, and the virus has just kind of exacerbated them. Why are they kind of in this vulnerable population? Well, if you don't have enough food, or you're worried about where you're going to sleep, you might be very stressed, you don't have clean water to drink, or you don't have the health insurance, so therefore you wait to go to the doctor. Those are all things that can kind of slowly build up in a person to slowly kind of make them less healthy, even in a normal, a young, healthy adult. And so having enough food, having clean water, having health insurance so you don't have to worry about how you're going to pay to go see the doctor if you're feeling ill, those are all really important things too in keeping vulnerable populations healthy and safe. All right, and like I said, it's a spectrum. Everything you can be old and not have enough money for rent, or all sorts of things. So it's all over the place here. So what can we do? Well, St. Columba has been doing a lot already. In the Bible, Job said, he referring to God, he saves the needy from the sword in their mouth. He saves them from the clutches of the powerful, so that the poor have hope and injustice shuts its mouth. We've had this mission to help out these poor, vulnerable populations since before the pandemic hit. It's why on our Wednesday Mass, we ask you to donate to Hope for a Village Child, Foundation Children in Need, Southwest Indian Foundation, Cross Catholic Hurricane Relief, VOA Homeless Shelter and Southwest Safe House, Manna Soup Kitchen, and many more. These people try to bring about changes both in the individual's life, so that one person who might be needing money for rent or one person who might be hungry gets helped, but also why try to change the system that had that person fall through the cracks, right? Too often our society praises people who take as much as they can and are winning all the time. And that's not what the Catholic Church mission is. The Catholic Church wants us to care for our brothers and sisters, all over the place, and to make sure everyone has a basic dignified human life. And so that's why we help these different organizations. So what can you do now? Well, first thing is write and talk to your family. That's the most important thing. Tell them that you love them, check in on them. It will really help them out. This is including your aunts and uncles and your cousins. And something really important. And, maybe you're feeling tired of doing Zoom meetings with them. Write them a postcard. Just say that you're thinking of them. It kind of brightens their day. Beyond that, if you're able to, when we're allowed to, volunteer with groups that are helping. Kind of like Luke said, when you give a banquet, invite the poor and the crippled and the lame, the blind, and you will be blessed. Although they cannot repay you, you will be repaid at the resurrection of the righteous. So what he means there is, like, if you can help someone, help them out. And so there's going to be plenty of opportunities to help out people who might be in need, or to help the environment to make the world that we live in a better place for everyone, right? It's kind of remembering and thinking of the other person in this time. Other things you can do, if able, donate at Mass again, or on your own. Like John said, if anyone has material possession and sees a brother or sister in need, but has no pity on them, how can the love of God be in that person? Dear children, let us not love with words or speech, but with action and in truth. John's here saying, if you are able to, even if it's small, make a donation. And so you can always reach out to the groups that we've always helped out and help them out still. Also, if able, write to the people in the town, state, and federal government and asking them for help in the groups. All right? Because we could make a stronger safety net so that nobody falls through and gets hurt, like and experiences being a vulnerable population. It's said in Proverbs, speak up for those who cannot speak for themselves, for the rights of those who are destitute. Speak up and judge fairly. Defend the rights of the poor and the needy. So there's ways that we can help both as a system level, like changing the rules of the government so that people don't have to feel like they are hungry, or don't feel like they'll lose health insurance, or feel like they're going to lose their rent and get kicked out. And there's ways we can help on the individual level, like helping out at the soup kitchen or preparing sandwiches for people, and kind of giving them food that way. So that's a both and situation in helping this out. So that covers the whole video today about who the vulnerable populations are and what we can do to help them out. As always, if you have any questions, feel free to ask them below. I hope you're all staying healthy, and I can't wait to see you again.